One of the most insidious risks associated with unsupervised supplement use is the way it can camouflage deeper, underlying health problems. Many supplements, especially those with anti-inflammatory or cholesterol-lowering properties like turmeric, niacin, and omega-3s, are taken by individuals who are experiencing vague or early symptoms of chronic disease, fatigue, joint pain, high blood pressure, high cholesterol, or brain fog. But instead of seeking medical evaluation, people often turn to natural remedies in an attempt to self-manage these issues. The result? A temporary easing of symptoms that may feel like healing, while the root cause silently progresses beneath the surface. Take turmeric, for example. Widely promoted for its anti-inflammatory effects, turmeric, specifically its active component curcumin, can reduce swelling and discomfort in joints, calm gut irritation, and even slightly lower inflammatory blood markers. But using turmeric to mask persistent pain, stiffness, or autoimmune flares can lead individuals to ignore more serious conditions such as rheumatoid arthritis, inflammatory bowel disease, or lupus. These are not conditions to be managed casually or indefinitely with over-the-counter herbal powders. Delaying diagnosis by suppressing symptoms with supplements may allow disease to advance to the point where irreversible tissue damage or complications have already occurred. Similarly, niacin, vitamin B3, is sometimes used as a natural remedy to lower LDL cholesterol and raise HDL levels. While niacin does have documented lipid-lowering effects, high doses come with considerable risks, flushing, liver toxicity, and blood sugar disruption among them. More importantly, relying on niacin without identifying the underlying reason for elevated cholesterol is a form of avoidance. High cholesterol isn't a standalone issue. It's often a sign of broader metabolic dysfunction, including insulin resistance, liver problems, or familial hyperlipidemia. Using niacin or red yeast rice to treat the numbers may obscure the need for a full cardiovascular workup or genetic testing. Meanwhile, the person remains at risk of heart disease, stroke, or sudden cardiac events. Supplements like ashwagandha, magnesium, or 5-HTP are often taken to manage symptoms like anxiety, poor sleep, or mood swings. And while they may bring relief, they can also delay necessary exploration of deeper issues, thyroid dysfunction, perimenopausal hormone shifts, or early signs of clinical depression. People report feeling better, while their condition slowly worsens in the background. By the time they seek medical care, symptoms may be more severe, treatment may be more complex, and recovery may be harder to achieve. This issue is further complicated by the placebo effect. Many supplements feel like they're working simply because people expect them to. There's a short-term sense of improvement that reinforces continued use, even when the underlying pathology is untouched. And because supplements often don't completely remove symptoms, users may believe they're keeping things under control, when in reality, they're just slowing the obvious progression of disease, without truly addressing it. There's also a troubling trend of people abandoning or delaying conventional care out of fear, distrust, or misinformation. Some choose supplements over diagnostics or treatment because they believe pharmaceuticals are unnatural or dangerous. Others are misled by online influencers promoting turmeric instead of methotrexate for arthritis, or cinnamon instead of metformin for diabetes. While certain supplements may play a supporting role, they are not replacements for clinical assessment, diagnostic testing, or evidence-based medical care. Another layer of danger lies in the way supplements can alter test results and confuse diagnosis. For instance, high-dose biotin, often taken for hair and nail health, can interfere with thyroid tests and cardiac biomarkers, leading to false readings. Curcumin and other anti-inflammatory compounds may suppress CRP and ESR levels, making it harder for doctors to recognize inflammation. Niacin can affect liver enzymes, complicating assessments of hepatotoxicity or statin tolerance. In some cases, doctors may misdiagnose, delay treatment, or overlook warning signs because the lab results don't reflect the patient's true condition, distorted by the supplements they forgot to mention. So, what's the takeaway? Supplements are not harmless placebos. They are bioactive compounds that can obscure real health issues, delay necessary interventions, and distort diagnostic clarity. While they may offer comfort or short-term improvement, they should never be used as a substitute for medical evaluation, especially in the face of persistent symptoms, abnormal blood work, or chronic discomfort. The best approach is integration, not avoidance. If you choose to use supplements, do so with full transparency and in collaboration with your healthcare provider. Share everything you're taking, track your symptoms carefully, and undergo regular testing to confirm whether you're managing a real condition or just blunting its warning signs. Health is not about silencing symptoms, it's about understanding what those symptoms mean. And the longer you use supplements to mask them, the harder it may become to reverse the damage when the truth finally surfaces.